Medical imaging techniques make it possible to obtain visual information about the body's internal organs without surgical incisions. One of these techniques is positron emission tomography, or PET. With this technique, not only can the anatomical features of the tissues be analyzed, but also their functioning. The PET image provides three-dimensional information on the blood flow and the metabolic processes taking place in the cells of a particular tissue. When a disease develops in an organ, functional disorders appear first. Anatomical changes only present in a later phase. This is why PET is so helpful in diagnosing diseases at an early stage. PET is most commonly used to detect tumors, but it is also used to find neurological abnormalities and measure blood flow in the coronary arteries. PET is usually accompanied by another diagnostic technique called computed tomography, or CT. The images obtained with PET-CT can reveal more anatomical detail, thus increasing the accuracy of the diagnosis. Before performing a PET-CT scan, a small amount of radioactive material, called a radiotracer, is introduced to the patient's body. A detector ring detects the gamma rays emitted during the radioactive decay of the radiotracer. The detector can detect rays coming from any direction within the body. The CT and PET scans are done simultaneously, so there's no need to change the patient's position. Fluorodeoxyglucose, or FDG, is a fluorine isotope attached to a glucose molecule. It is commonly used in PET scans. FDG accumulates in tissues where glucose uptake is increased, in other words, where significant metabolic processes take place. This fluorine isotope has a very short half-life, from 2 to 110 minutes. The disadvantage of this short half-life is that the PET scan must be performed within a short time after the isotope is administered. The advantage is that it represents a smaller radioactive load for the patient. Following intravenous administration of the isotope, the PET-CT scan starts within 50 to 60 minutes. This is the time necessary for the isotope to reach every organ in the body through the circulatory system. After that, the isotope will only be present in tissues where significant metabolic processes take place. Isotope accumulation can be observed in the brain, the heart, the bladder, and the kidneys. If there is cancerous tissue in the body, the PET-CT scan can detect that too, since cell proliferation in tumors requires a high amount of energy and involves an elevated glucose level. As the fluorine isotope decays, it emits positrons. The positrons interact with nearby electrons, producing gamma rays that the PET system can detect. The PET-CT device takes images of the body perpendicular to the longitudinal axis of the body. These slices are then combined to create a 3D image of the entire body. This 3D image enables physicians to identify the exact location of the tumor.